Hello and good evening, everyone. Welcome to the sixth episode of Alumni Talks with the Recommended Practitioners. I am your host Sanjana Purohit from ICHAS, and today we are in conversation with Jessica Gandhi, and she is a clinical psychologist. I would quickly like to introduce about our organization. ICHAS is an organization dedicated to behavioral, emotional, and mental growth of individuals from all the areas of the society through education, intervention, and guidance. Our institution is based on the solid value system of quality and philosophy of positive psychology, where we believe that therapy is not about focusing upon the weaknesses but also about finding strengths. Before we begin, I would also like to mention about our MHP challenge, an initiative by mental health care practitioners requesting people to seek help before it's too late. I would also request everyone to start asking us questions on the comment section, and we would surely like to answer to them. So let's see, where is Jessica? Till she joins, I would say a quick hi to everyone. Hello everyone. Y'all can ask us questions, and Jessica is joining us. Hi,
Hi, Sanjana.
how are you?
I'm good. How are you?
I'm good. So I am
Great.
just coming to your introduction.
Okay.
Jessica Gandhi, she is a clinical psychologist who has been trained in psychotherapy and psychological assessment. Not only does she hold a postgraduate diploma in cognitive hypnotherapy and life coaching, but also is a master practitioner in NLP from ICHAS. Jessica has also been certified as a psychological first aider. She has been an integral part of the Department of Psychology at Messina Hospital for over a year, where she has worked extensively on the psychological evolution, psychotherapy, counseling, and taking groups therapy sessions with the clinical and the general population. So this is an introduction about Jessica.
Thank
Since
you
I
so
have
much.
given a brief introduction about yourself, can you tell us something about yourself more and what do you do?
Sure. So maybe I'll start off with a brief about my education. So I have completed my master's in clinical psychology from SNDT University, and I have been trained excessively in testing and assessment as well as psychotherapy. Like you already mentioned, I'm a certified cognitive hypnotherapist and master practitioner of neurolinguistic programming.
Perfect. And what are the types of cases that you handle?
So, because I was working at Messina Hospital, a lot of clients that we would see would usually suffer from, anxiety, depression, schizophrenia. So basically, the clinical population primarily. And I have worked extensively with them, from assessment to conducting therapies for them. And so, again, like I said, depression, anxiety, a lot of clients also used to come with post-traumatic stress disorder. We would also have support groups for them. So we would also do group therapy with them,
Wow.
where, we would have animal-assisted therapy, arts-based therapy. So, yeah, these are some of the clients and the kind of work that I have done previously.
Wow. The support group is like amazing. So even we have support groups for psychologists, then support group for the LGBTQI community. Then
Very nice.
recently, and then we also had a support group for the COVID-19. So people
Okay.
having anxiety during the COVID-19 situation
Hmm.
were attending those support groups. So
Excellent. I think
support
iChars
groups,
is doing a
yes.
wonderful job when it comes to support groups for sure.
So, Jessica, what are the different types of approaches that you use?
Okay. So, one of the most important things as a therapist I've realized is therapy is not a one size fits all approach, right? So, even if you have, say, two clients who have been diagnosed with clinical depression, their entire symptomology, their history, their environment is going to be completely different.
Right.
So even if I'm seeing two clients who have clinical depression, my mode of therapy is not going to be the same. So that's why I have trained myself in an eclectic approach, which basically means, learning different approaches so that I can cater to different kinds of people. So I have trained in CBT, neuro-linguistic programming, CHCP, as well as I use techniques from mindfulness as well.
Perfect. Like so much. And even I completely agree to this, that uh, one therapy cannot be used with everyone. So there is
Absolutely.
always a different ingredient in the therapist's recipe book. So you have to
Absolutely.
take up.
You have to take up different. So, for some people, visualization may work. For others, just simply talking about what they're going through would help. Some people who are, they're slightly more intelligent, or they have the cognitive capacity, you can probably do CBT with them extensively, where they consciously have to understand what they're going through and then make some changes. So again,
Right.
every client is unique, and therefore even the kind of therapy that you have to come up with, it has to be tailored for their needs.
Yes, I completely agree with
Yeah.
that. So, how do you use CHCP in your practice?
Okay. So like I said, the kind of population that I see is mostly clinical, but simultaneously, I also see a lot of counseling clients. So, people who are going through some sort of relationship difficulty, or they may have, concerns regarding goal setting, or how to increase their productivity, or, increase their levels of motivation. So, with these clients, I extensively use the soft C model, which it's actually like a brainchild of iCharts, right? And I have actually come to realize that it's such a powerful model when it comes to goal setting. And there's so many other goal setting models available, which we used to use previously, but
Mhm.
SoftC is, it literally encompasses everything that you would possibly need in order to move from like point A to point B in terms of progress or growth. So if you want, I can probably explain a little bit more about
Yes.
SoftC.
Since many of them won't be aware of the soft C, a brief
Okay.
introduction.
Okay. So SOFC, like I mentioned, is a model for goal setting, and it's actually an acronym. So S stands for situation. So situation is, what you're currently going through. Then O stands for outcome. So, say from point A to point B, like what is the outcome that you're looking at? Then F stands for future, wherein, you extensively write down what your future would look like after you achieve your goal. Then T stands for tasks. So it's basically you come up with a list of tasks that you have to undertake in order for you to reach your goal. Then is again S, which stands for suggestion. So this is a very strong suggestion that you give yourself, right? Like, yes, I can do this, or it's something which is very
Yes.
personal,
Yes.
right? And then E and A stand for evaluation and assessment. So again,
Right.
once you've done all your tasks, you go back and you evaluate, have I reached my goal? If I haven't, then what are some of the other changes that I need to make? So then again, you
Yes.
evaluate the whole thing and then you go ahead with it. So I've actually
Yes.
realized that this works
Hmm.
even with, clients who are suffering from anxiety. They're just constantly so anxious. They don't know what the
Hmm.
future is going to look like, right? So they're
Yes.
always worrying about what's going to happen in the future, which is leading to anxiety. So with
Right.
them, when I have done this, it's sort of given them a stable ground, where they're trying to envision what their future would look like instead of getting anxious about it. And then they're also willing to take some of the necessary steps required to reach their goal.
Wow.
So yeah,
So Shri
that's
Pandesh Pandey has asked that is loneliness and depression the same?
Loneliness and depression is not the same. However, loneliness can be a part of depression. So, if depression is a larger umbrella, loneliness can be one of the symptoms of depression. But with depression, there are loads of other features like, loss of motivation, loss of pleasure, disturbances in your eating patterns, sleeping patterns. So, again, loneliness is not the same as depression. However, a person who is depressed can experience loneliness.
So we hope we have answered your questions, and if you have any other questions, you all can surely question us on the comment section. A quick hi to everyone. Hello, Misbah ma'am, and hello, Damini, everyone. So a quick hi to them. Okay. Um, so what were the challenges that you have faced before learning CHC?
Okay. Um, Again, as the therapist, you have to be very dynamic and fluid in your approach. But one of the things that I faced before learning CHCP was sometimes, when clients are coming to you, they're not in the right frame of mind. They're obviously very disturbed, or they're suffering, or they're going through a lot of pain. So when I tried using, slightly more traditional approaches, where, I would explain how the mind is working, or, what their entire thought process is like, and, what are some of the distortions, or, just basically how their mind is working. They were not able to grasp that, not because they didn't have the cognitive capacity, but it's just that they were going through so much pain, or they were already suffering so much that they were not in the right frame of mind to accept, that new information. And one of the key challenges that a therapist usually faces is either the clients are not able to accept what's happening to them, and when they're not able to do that, it sort of hinders their progress. Somewhere they're not able to make that breakthrough. So it becomes
Right.
really important for them to accept. But however, when they're in that frame of mind, and because they're not able to accept, I realized that some of the techniques that I was using from that I had learned in CHCP, like say for example anchoring, I didn't have to explain too many things to them. I didn't have to
Okay.
explain how the structure of the mind worked. I could literally take, a positive feeling that they wanted to experience, and I could anchor it for them, and so they were able to get into a better frame of mind. And then again, if I tried to explain, how the mind functions, they were more receptive to that, because they were already starting to feel a little better. So I
Right.
think that's one of the key areas that I found CHCP was really able to sort of bridge that gap, where I didn't have to, really get into too much detail initially, but I could just help them start feeling a little better.
Right. So since many of them won't know what is anchoring, so can you explain us a bit about that?
Okay. So anchoring is basically a process where you take any positive state that you want to experience. You take that person to say maybe if they've experienced that state in the past before, or you ask them to visualize, how they would feel. So let me actually take an example.
Okay.
Say for example, if they want to feel calm. Okay, someone who's
Yes.
anxious, they want to feel calm. So, what I would do is I would either ask them to think of a situation in the past where they have felt calm before, or if they've never had that kind of a situation, then I ask them to visualize what it would look like,
Right. Right.
right? So when they're at the peak of that experience, we probably use, say, different parts of the body. So usually it's fingers, or maybe a shoulder, like, your shoulder or something that is easily accessible by them. And when they're already at the peak of calmness, I'll anchor calmness on, say, their finger. So when I do that, what happens is in the future, whenever they want to feel calm again, the moment they press that anchor, the moment they press their finger, they'll automatically be taken back into that state where they're feeling calm. And because
Right.
it's something that's, on your body, okay, you're literally using your fingers or your shoulder, it's something which is accessible anytime. So you don't have
Right.
to rely on, external resources to feel better.
Hmm.
You immediately can go from a state of, high level of anxiety to feeling calm. So that's basically the process of anchoring.
Actually, this really helps with the anxiety clients because अगर उनको हम बोलते हैं कि keep calm, they won't keep calm because उनको
They
पता ही
won't.
नहीं है काम है.
Yeah, because they don't know what that feeling of calmness even feels like, right? They've not
Yes.
experienced that because they've always been so anxious. So that's why,
Right.
sometimes a lot of my clients, they're like, but I've never felt calm before. Like I've always been hyper, I've always been anxious. So how do you expect me to, think of an incident where I felt like this? So that's when, you ask them to visualize. Okay, theek hai, okay, in the future, just visualize that you're very calm. What are some of the things that you could be, feeling? So then
Right.
we use that experience and anchor calmness for them.
Um, so Shripedesh Pandya has again asked that how to handle cheating from partner.
Okay. So when it comes to cheating, again, you can go two ways. Okay. You have to also understand some of the reasons as to why that cheating occurred. Again, see, everyone's point of view would differ in terms of should we continue staying with that partner, should we leave that partner. But apart from that decision, I think one of the most important things that any relationship should foster is good communication skills, right? Because when communication is one of the most important pillars in a relationship, so if you're not effectively communicating with your partner, it's going to lead to a lot of friction. And because of that friction, then you never know, what a partner might end up doing, right? So there's actually a really nice book. It's called Five Love Languages.
Yes.
And it basically speaks about, every individual has a very distinct style of understanding and receiving love. So, I mean, I won't go into too much details, but I think whoever asked that question, I would really recommend you reading that book first. It allows you to understand how you want to be loved. It allows you to understand how your partner also wants to be loved. And when you're able to bridge that gap, when two partners are able to come, reach some sort of a middle ground, there's you're reducing that friction, you're reducing, all of that extra miscommunication that could possibly lead to someone cheating.
Uh, he is saying thanks a lot. Do ask us questions
You're
if you have
welcome.
any. So actually, even I agree, and I would like to add something to this. That today I was attending a relationship workshop that is going on, and
Mm.
Mamta ma'am and Misbah ma'am were conducting it. So they told ki, there are three conflicts in a relationship. Why the conflicts happen? So I always knew ki communication, and then they added ki there is one communication, other is money, and the third is sex. So these three things create a big conflict. So yes,
Right, right.
and thus Steves has asked that, ma'am, please name the book one more time. So it's Five Love Languages. Okay. Yes, and you were saying about the anchoring part.
Yes, I
Huh,
completed
see.
anchoring. Yeah. So with the help of that calmness example, I explained how the process of anchoring works. Yeah.
Okay. And how has CHCP helped you overcome those challenges? Like if you could give a case study support.
Okay. Um, so I think about 4 to 5 months back, I had this very interesting case where this old lady, I think she must be about 57, 60 years old, she came in with severe leg pain. And it was so bad that she started developing a limp. And she had undergone extensive medical procedures, a lot of testing to see what was actually wrong. And nothing came up on her tests. So then they referred her to a psychologist, and that's when she came to our team. And right at the onset, the moment you know that nothing has come up in her medical tests, it has to be
Mm.
psychosomatic concern that, you could possibly
Right.
be dealing with, right? So with her, whenever she would come for sessions, she was always just crying. She
Mm.
was always complaining about her pain. When I tried to, use a few techniques with her, or even if I tried to, get her to start talking about what's actually going on, she would refuse. She's like,
Mm.
my leg is hurting and I can't walk. And it was so bad that she was not even able to walk for 2 minutes straight. After every 2 minutes, she would have to pause. Either she would have to sit down or she would have to take support of like her caretaker. So it was basically her condition was really bad, and with time it
Mm.
was continuing to deteriorate. So that's when I realized that maybe I could try using soft C along with reframing.
Mm.
So reframing is basically a process that helps you understand some sort of a positive intention behind that behavior. So there had to be some reason why her legs were aching, why she was developing a limp, right? So
Mm.
that's when I did this whole process of reframing with her. And at the end of the process, I realized that she had a great need for attention.
Mm.
And as and when, we went deeper into her case history, we realized that she was unmarried
Mm.
and she wanted to get married. But for some reason, it just never worked out for her. Her family lives in the US.
Mm.
So, she was not even able to stay in touch with them previously. Then what happened was she started developing this pain. So again, her family would keep calling her, checking in on her, giving her attention, giving her a lot of sympathy.
Mm.
And that's why this behavior of hers kept continuing because
Mm.
she was getting the attention that she was actually
She
craving
required.
for
Huh.
before.
Right.
Exactly. So
Mm.
again, her neighbors started spending more time with her. They would keep checking in on her. Even when, she would go to the garden with like her caretaker, people would be like, oh, how are you feeling today? Aapka pair kaisa
Mm.
hai? Doctor ne kya bola? Are you going to the physiotherapist? So again, people
Mm.
started having a lot of conversations with her just because she had started developing leg pain. So now she was getting everything that she wanted, but it's just this
Mm.
was a not the most constructive manner in which she was actually getting what she wanted. Because
Mm.
at the end of the day, it was still a limp and her legs were actually hurting her. So she still had to
Right.
go through that pain.
Mm.
So yeah,
So you helped her with using the reframing and the softs.
yes. We also did a lot of inner child,
Mm.
somewhere there were a lot of other issues as well that cropped up. But primarily for her leg pain, I used reframing. And within 2 weeks, she was already starting to get better. And, then we obviously worked on a lot of her communication skills so she could
Mm.
stay in touch with people. So she didn't have to, so
Wow.
she would still continue getting attention from others
Mm.
as well that she
Mm.
wanted anyway. So then again, we also worked on a different like soft skills for her.
So you also worked with the communication skills of her.
Absolutely.
Wow. Wow.
Absolutely.
So it is rightly said that you cannot only visit a counselor for only your problems, but also for your own betterment. So you actually
Absolutely.
did that.
Yeah. Yeah.
And you were mentioning about the inner child. Can you tell us what is that?
So inner child is basically what happens is somewhere in the past. So now when I'm saying past, it's literally any moment that has gone by from the present moment. So it could be, something that you've probably experienced say, an hour back or 10 years back or 20 years back. Okay. So what we do is if you've experienced any kind of event or a situation that has, deeply left you scarred or traumatized, or, it's just some situation that has caused a lot of, emotional turmoil. So what this process of inner child does is you go back to that child, okay, which is your own self. You go there, you converse with that child, you speak to him or her in a very caring way, as if, Okay, I understand that you didn't have someone before in the past, which is why you started behaving like this, or which is why, these are some of your patterns. But now I understand what you're going through, and you no longer need to do it. So basically, you're actually talking to yourself as if you're talking to someone else with so much love, with so much compassion, that you allow a part of yourself, which is the child, to start healing. And when that child starts healing, you'll automatically start seeing those differences in your present life.
Wow. So it is like
So,
talking to your own self as a child, the baby
absolutely.
version of yourself.
The baby version of yourself, right? Because a lot of times, when we're going through something, we don't have someone who's giving us that love, who's giving us, who's showing us that kind of compassion. So it becomes really important to, sort of revisit that part of you and heal yourself from there. Because a lot of
Right.
things that you're experiencing, or a lot of behaviors that you're indulging in, are a reaction to what you went through before.
Absolutely agree with you. Right. So it is the past baggages that come ahead.
Right, right.
Okay, so my next question is that how important is it for other psychologists and people from your field to know about CHCP?
Um, I have personally benefited a lot from this course. So I would definitely recommend that every every therapist should at least have some kind of exposure to CHCP, for the simple reason that, see, anyway, right now we are all learning different therapies, because we know that, you know, if this works with this client, not necessarily the same technique will work with another client,
Right.
right? And the thing is, CHCP shows fast results, which, other traditional therapies, you have to, sort of do like 15, 20 sessions for a lot of, change, which to be actually observed. Whereas with
Right.
CHCP, like some techniques, it literally takes 1 or 2 sessions. Like I mentioned about, that client that I had, the one with psychosomatic pain. Within 2 sessions, we started seeing a lot of change in her. Like her pain was going away, right? So you can see that it's basically the core of CHCP is your, not only are you looking at the way, your mind works consciously, but you're also looking at the unconscious processes of the mind, right? So
Right.
a lot of these things, we may not be actively aware, but unconsciously these things are happening in the background within us. So CHCP is actually a really great therapeutic modality, which allows you to sort of go even deeper into your unconscious processes and work from there. And when
Right.
you start working from that direction, the changes that you see are a lot more faster and long lasting. There are fewer chances of that client relapsing into that same state. So
Right.
this has been my personal experience. So that's one of the reasons why I would highly recommend people to train themselves in CHCP.
Yes. Actually, and that plus, as you rightly said, that one therapy cannot be used with everyone. So you have to have
Exactly.
a whole bundle and a branch of therapies that you can use. कि ये नहीं चल रहा ठीक है तो ये ले लो ये नहीं तो ये.
So ye le lo. Yeah.
Yes. So it
And the
is
thing is,
it's nice.
sorry, go on.
You were saying something.
Yeah. So the thing is, CHCP, there are so many techniques. There are different diagnostic techniques. There are different, techniques for even bringing about change. So wherever you feel like, okay, maybe this one is not working, immediately you can pick up another technique that will work really well. And the thing is,
Yes.
more or less, these techniques, they work on the unconscious processes of the mind. So somewhere you know that whichever technique you use, results are going to come only. You're going to be able to see the results immediately.
Yes. So it is. I completely agree that. And another thing is that कि it is very seamless that if this is not working, even the client won't know that I have changed the
Exactly, the
flow.
process. Yeah,
Yes.
yeah, yeah.
So it is like very seamless.
It's very seamless, like you said. You can literally switch from like one technique to another if you realize that the client is maybe not comfortable, or if the client is not, responding to that technique, then you know that, okay, this is not happening. Let me just continue with whatever I'm doing, but now introduce another technique which will work better.
Right. So I always ask these questions to all our alumni. Which therapy or which technique is your favorite? Like you use always.
Um, okay, so again, very two different things. My favorite technique is inner child, because personally I have benefited a lot from inner child. But the technique that I use the most in my practice is soft C and anchoring. Because usually my sessions are, I try to keep them goal oriented. So, even when I'm starting the session, I also want my clients to see what the end goal is, and how much time they want to give, approximate time, say 2 months, 3 months, but where do you see yourself? So because it's goal oriented, I think I tend to use soft C a lot more, because it's very clear. Like, you can't go wrong with soft C. Everything is broken down for you, so you know that if I have not done this, then this goal is not going to be met.
Right.
So that's what I use most commonly in my therapy sessions, but my absolute favorite is inner child. I love it.
Even I loved inner child because the way we communicate with the our inner the our whole self, it is so beautiful and it gives me goosebumps. Ki, oh shit, this is the way you have to communicate always with yourself.
Yeah, yeah. And the an outcome of inner child is, once you realize how you need to be spoken to, it also makes you that much more empathetic towards other people. So, if you're
Right.
having a conversation with someone and you know that it may lead to some kind of conflict, automatically in your mind, you're like, you know, if this is how I have felt in the past because of something that happened to me, do I want to put the opposite person through the same thing that I went through? So that kind
Right.
of empathy, you automatically start, like imbibing, and you're that much more careful when you're interacting with others. So it has, I personally feel like it has benefits both ways, for yourself as well as for others. So everyone should just practice inner child.
Okay. So how has CHCP helped you in your personal life?
Great question. So I actually used to procrastinate a lot. And I would always make like a really nice long list of goals that I want to accomplish. And, I would even break it down. So I would even write down the tasks that I need to do in order to reach my goals. But when I would actually sit to do it, something would just snap. I'd find other things to do, either it's, say, watching a show or cleaning or just anything apart from what I actually had to do. And what happens is, when you start procrastinating a lot, you also start feeling guilty, because you know that this is something that I have to do. I have decided this for myself. Why am I still not doing it? And that's when, I realized that I had to do some of these processes on myself if I actually wanted to, get out of this zone, because I'm not being as productive as I would want to be. And
Right.
along with that, even if I'm doing something other than, going after my goals, I'm still feeling guilty about it. So either way, I was losing.
Right.
So that's when I decided to do this whole process of reframing and also parts integration, because there was a very strong part of me that just wanted to chill, relax, not do anything, and an equally strong part which wanted to, sort of go after her goals. So
Right.
when I did this entire process with myself, I learned so much more about myself. I realized that my procrastination was just an external behavior or a reaction of what I was actually going through, which was some sort of anxiety related to that task. Maybe I was like too scared to venture into something new. So the moment I was able to pick on that, then I knew how to work. again, then,
Hmm.
I continued with the whole anchoring process where, I put myself in a positive frame of mind, and then I was able to, sort of go after my goals. So yeah, I think that's one of the most like important things that I have also done for myself, using techniques from CHCP.
Yes, I remember during our iChamps meeting also, you were using the SOXY module, and
Yeah.
you reached your goal during that time only, right?
Yeah. Yeah, I did. So
Yes.
again, when I had made that task list, if you would have gone through it, it was so extensive. I had like a list of
Yes.
20, 25 things that I
Hmm.
wanted to accomplish. And the more I kept looking at that list, I was like, oh my God, this is not happening. Let me just shut my computer right now and I'm just going to go watch a show. And then I realized that in order for any growth or any progress to happen, you
Hmm.
somewhere have to just sit with yourself and like sort it out. So for me, it was through all of these processes that, I think it really helped me, along with the iChamp support group, because I had all of y'all, y'all were also
Yeah.
constantly supporting me and, like, okay, go ahead, like this, you're doing this well, this is the feedback that I was receiving. So it was actually a really beautiful process that
Hmm.
helped me sort of overcome procrastination.
Yes. And I remember you telling me that you have also started with some webinars or something. So can you mention
Yeah.
about that?
So I had actually conducted 2 or 3 webinars on relationship management,
Hmm.
conflict management, and I'm also looking at, creating workshops right now. So everything is still underway. I'll probably roll out these things in the next couple of weeks. But yeah, I've been getting all of these things in place now, and I feel super productive.
Okay. So anyone who would like to be a part of those webinars or workshops, you can get in touch with Jessica. Jessica, please mention your user ID so that everyone could get in touch with you.
I will. So my Instagram handle is still minds by Jessica. So I'll put it in the comments also.
Yes, yes.
And all my details are also on my Instagram page. So if anyone has any questions, if you're looking at any kind of workshops, then that's the best platform for you all to remain updated.
Sure. And my last question is that uh, can you please share your future plans with
Sorry, I couldn't get you. Your voice was cracking.
me? Hello.
Yeah.
Can you hear me now? Okay.
Yes.
So I was asking, what are your future plans?
So, the reason I even got into this field is because I somewhere wanted to make a difference to people's lives. And just, given the whole current scenario, there is a great need for more mental health professionals. And somewhere all I want to do right now is create a lot of awareness that, professional help is available. Don't see mental health as something which is stigmatized and still a taboo. People are talking about it now, so this is the best time to get all the help that you possibly can. And that's my agenda for now, to create more and more awareness about mental health, mental wellness even. And yeah, I'm also conducting workshops, and I'm also looking at starting a few support groups, which again, it'll be updated on my Instagram page, so stay tuned for that.
Yes. And also, this brings me to the point that we have also started with the MHP challenge, that is Visitor Mental Health Care Practitioner Challenge.
Yes.
And we also have these awarenesses that, seeking a mental health care professional is always important, not only to find your problems, but also to achieve your goals. So I would request everyone to be a part of it. If you're not a psychologist or a mental health care practitioner, you all can still make a video that you can visit a mental health care practitioner. That is that simple. So yes,
It's
and
actually really nice how iCharge is coming up with so many different ways to even raise awareness alongside creating so many support groups, not just for people who are going through something, but also for psychologists.
right.
So I think you mentioned that right at the beginning, right? That there's also a support group for psychologists. So
Yes,
it's really good that it's a safe space even for psychologists to, sort of come together, share some of their insights, share some of their cases. And it's people get to learn from each other. And that's
right.
what, this field really needs because at the end of the day, we're dealing with the human mind, which is extremely complex. So
And even we as a therapist and mental health care practitioner need another therapist with us. So it is always,
absolutely.
yes. So in those support groups also we share our case studies. Matlab we have the confidentiality thing always in mind,
Right.
but we also share our concerns, and there are other therapists who would say, ki, you could have done this also, you could have done this also. So this really
Yeah,
helps a therapist. So
absolutely.
yes. Okay. So, as we are in the end of today's session, thank you, Jessica, for your valuable time and your beautiful inputs. Thank you, everyone,
Thank you.
for asking these beautiful questions to us. And I'll meet you in the next Wednesday, and we'll be in the conversation with a healer and a relationship coach. So, thank you, Jessica.
Thank you so much, Sanjana. Thank you to the iJars team and for all of y'all for watching this.
Thank you.
Okay.
Bye-bye.
Bye bye. Take care.
Bye.